Does your dog have some behavioral problems that you just can't seem to solve? If so, your pet may be suffering from a canine form of obsessive-compulsive disorder. Our resident veterinarian, Marty Becker, joins us via Skype from his home in Idaho with more information on how you can help them. Hello, Dr. Becker. Great to see you again.
Thanks for having me.
So this study in January's Nature Molecular Psychiatry journal found a chromosome linked to OCD in Dobermans. Tell us a little bit about the study and what it means for vets and pet owners.
Well, it's kind of interesting. First of all, it shows that there's a genetic predisposition for certain behaviors. You know, it may just not be that they're got a crazy dog or a bad dog or this crazy cat that pulls its hair out, but actually a genetic predisposition for it. The exciting thing is if we know that there's a genetic predisposition for this, we can start to work with breeders to identify at-risk lines of dogs or cats and selectively breed to reduce it, and eventually be able to test for that before we breed. And the other thing I think it validates is for veterinary behaviorists have long talked about, they thought that there was phobias like thunderstorm phobias, anxiety, panic disorders, obsessive compulsive, even ADHD in dogs and cats, and now we're starting to see that in fact that is true, and you could work with the veterinary behaviorists to identify and then treat these neurologic conditions with a combination of behavioral training and drugs.
So how does this OCD present itself in dogs? What should dog owners be looking out for?
The thing that's interesting here, first, they found it on what they call chromosome 7 in dogs, and the identical gene is in humans. It happens to be on chromosome 18. But in humans, when you think of obsessive compulsive disorders, you think of obsessive hand washing, or rearranging things all the time, or head banging in some young children. For dogs, it can be a locomotor sign, like they'll circle or they'll pace. It can be an oral behavior, a gastrointestinal thing. They will suck or eat certain odd foods all the time. It can be a dermatologic thing where they will lick, they will pull hair out of their tail, they will chase their tail, they will bite their nails. It can also be a neurologic sign, like you'll see staring, you'll see freezing, you'll see them snapping at imaginary flies. And although you see a lot of these on America's Funniest Videos or on YouTube, they're not a laughing matter at all. For dogs, it can be dangerous. You can have a dog that obsessively swims in a pool or circles and falls off stairs, or they'll actually chew their skin right down to the bone. So it's definitely no laughing matter.
And how common is this problem?
Well, in humans, you see obsessive compulsive disorders in about 2% of the population. In dogs, it's about 5%. But in certain lines of Dobermans, it's 70%. So you see it in Doberman retrievers, you see it in German Shepherds, you see it in Bull Terriers, you see it in Labrador retrievers, Scottish Terriers, and certain Oriental breeds of cats like the Siamese and Persians.
So, since this study did follow Doberman Pinschers, though, but as you said, there are many other breeds susceptible to these behaviors. What about cats, other kinds of animals? Are they also susceptible?
Well, what you see in cats is the Oriental breeds, specifically the Siamese and the Persians. But you'll see some of these strange things, like they will barber themselves. They'll just pull out tufts of hair, keep pulling hair out in certain spots. They'll bite obsessively on their tail. I was just at a conference of leading veterinary behaviorists and trainers, and they were talking about one cat that would actually kept sticking its tail in its mouth, vomiting, and then it'd stick its tail back in its mouth and vomit over and over and over. And that's the thing about obsessive. It sounds kind of funny when you first hear it. It's like a cat with an eating disorder that wants to, instead of sticking its finger down its throat, it sticks its tail down its throat. But what happens is with obsessive compulsive disorders, these behaviors either increase in frequency or they're out of context or out of duration. So you may have a dog that gets very nervous. There's a new dog introduced in the house. We're in the veterinary hospital, and out of nervousness, out of stress or conflict, they may suck on their flank, or they may spin in the air or chase their tail. But over time, with obsessive compulsive, it happens over and over again out of context. There's no stress, there's no conflict, but they do it, and they continue to do it over and over and over again. And that's really when it becomes a problem.
Absolutely. And so, Dr. Becker, what can pet owners do to help their pets?
Well, first thing, you want to eliminate the stressors. Like, if you have a neighborhood dog that passes by and that stresses this dog to do the obsessive compulsive disorder, or a certain visitor, some situation, you eliminate the stressors that trigger it. Then you want a regular routine. They love a routine, so they know we're going to get up this time in the morning, I'm going to be let out, I'm going to be fed this time, like this is my play time, so they love a routine. You want to keep them busy. There's a saying among veterinary behaviorists that a busy dog is a happy dog, or a tired dog is a happy dog. So you want regular play times, exercise times. One of the things you want to do too, I would recommend you throw your food bowls out, and this is not just for people with OCD. At Almost Heaven Ranch here, we have no food bowls. We use food puzzles. So there's different kinds of, you take certain toys and you freeze food in them, like Kong toys, or you use the Busybuddy line and you fill them with things just like playing slot machines. You never know when the food is going to come out.
So they have to search for their food? They have to go on a scavenger hunt, as it were?
You can do that too. You can just take food in the summertime and just throw it out in the yard and have them scavenge for it. But these toys are actually like things, are like slot machines. You never know when they're going to pay off, so it takes work and skill and manipulation. Also training. You want them, you never want to, if your dog or cat starts to do these behaviors, you never reward them or punish them for doing it. What you do is you put a head collar on them or something. Head collars are those things that look like muzzles, but they're not. They fit around the back of the head and over the top of the nose. There's kinds like Gentle Leader people have heard of.
Very important.
That interrupts the behavior, and then you redirect them to something you want them to do, like to sit, lay down, do their tricks, or go in kind of play activity. And finally, your veterinarian may ask you to use medications. So there's certain medications you can use. Reconcile is one, Clomicalm, and these are kind of chemical crutches that increase the serotonin levels. And
Dr. Becker, thank you so much. I'm so sorry to cut you off, but we've run out of time, but thank you so much for all that great information.
Thank you.
And for more of Marty's pet advice, be sure to check out the pet section of the GMA page at abcnews.com.